I'd probably characterize as a case series. What happened was we were referred two patients in a very short span of time that had an unusual reaction when they received epinephrine while they were undergoing emergency treatment for anaphylaxis. And in reviewing their cases, it seemed pretty clear that they developed a bradycardia, or slowing of the heart rate, shortly after receiving the medication, which has been shown to happen in certain circumstances, but it had been the first time I had seen it in my kind of newer career so far, and so I thought it would be important just to share those experiences and make sure people, especially the allergists, were aware that this is a potential side effect of epinephrine, and then think about some of the reasons why these patients develop this reaction. Just based on the 3 patients that I've reported on, it's hard to make any really firm or definitive conclusions, but it's just something that can happen, something that I think people should be aware of, not only providers but patients as well, just so they're fully informed of what they may experience, even though obviously epinephrine is a very important medication. It's a life-saving medication. I think it needs to be used in any circumstance where there is a potential for severe allergic reaction, but everyone should just have in mind that it doesn't always go as smoothly as we all hope it will. It could potentially happen in children as well, but the factor that we identified in the patients we were looking at is that they were on another medication called a beta blocker. And so beta blockers are used for various medical conditions. Some are very specific to how they work, and others are a little bit what we call non-selective. So these 3 patients happen to be on non-selective beta blockers, which we think, in looking through some of the past reports, was a significant risk factor for why these patients experienced this unusual reaction to epinephrine. And so we talked with the patients that we saw with our concern that there may be additional risk for them if they continue to stay on a non-selective beta blocker. And so we had them discuss the use of that medication with their primary physician or cardiologist or whoever had prescribed it, to make sure that that was the most appropriate medication, to see if maybe we could change that up.